For MAHEC, the timing couldn't have been better because we've been working for, I'm only here 18 months, and since I've been here, we've been working on issues around health equity and how to bring our patients in much closer to get what they need and to really share what matters to them with their physicians. So this was just perfect timing for this program here. I'm going to quote some of the wonderful people who were here today because I think they said it so much better than I probably can. Leslie talked about pausing, and Heidi talked about translation, and Tom talked about collaboration. And I think those words are very powerful and meaningful. It's the idea of getting the conversation to be between the patient and the provider, not just one talking and the other not listening, but a true exchange. So for me, as a researcher, I can't help but come to it at that lens. What's really been impactful for me today is this concept of collective stories and how we can bring together the data and the stories to really elevate the voice of individuals and communities. You know, to understand who are providers, who are patients, what are these stories we're bringing together, and what's important to us and what do we need. So that was a really key issue for us in putting the workshop together this, here in Asheville. We invited people intentionally from different communities and who represent different voices. So we had folks from several behavioral health organizations because the mentally ill need to be heard. We brought together members from different African American communities. Their voices have been very unheard and stomped on, in fact, and put down. So by bringing together, we have representatives of folks with dementia and just the elderly as a group. All of these different groups need to be heard. It's not, and somebody asked me today, is that divisive? And I thought, no, it's not divisive because we all use different language. And so each group's language and needs need to be understood differently. So by having everybody in the room today, I'm hoping that we'll create those messages that are unique for them. I think there's issues for providers as well as for the patients. So we heard today there are providers who are isolated. They don't have contact with their colleagues. They burn out. It's stressful for them. They have issues brought to them that they don't have the skills to address, and trying to get them to the nearest specialist is very challenging. So providers have their own issues, and then I think the number one thing for patients is knowing who can I go to and how far away is it. And if you look at a map, it may look simple as the crow flies, but that's not what the mountains are like. It's not as the crow flies. It's up and around and over. So transportation is incredibly important. We still have places here that don't even have broadband internet, so you can't always rely on telecommunication either. So lots and lots of issues that are unique. But we have amazing networks and participants here. We had folks from the Western Carolina Medical Society who have the ability to touch all of our providers in this area. So we really did make an effort to bring together folks of different agency who can reach out. Definitely getting on the table the structural racism and what we need to do, the emphasis on systems change, and that's where I think that the collective stories are so incredibly important, because if we're going to enact change, we need to do it at the system level, and the way that we're going to communicate what that need is to the folks making the decisions in Washington and at our state level will be through those collective stories. So that is, for me, that number one take-home message. Pull our stories together and create our shared voice.